Hi guys, Campbell here from Wellness and Body. Today showing you another of our trigger point releases to go with our Self-Treat Saturday Facebook post. So today we'll be using the trigger point ball to try and release the Quadratus Lumborum, or QL. So the QL is a muscle that comes from the bottom of the rib to the top of the pelvis and is involved in side bending the spine or hitching the pelvis. It typically can become tight with back pain. So we're going to be showing you how to use the trigger point ball to try and get a little bit of tissue mobility and release through the area. Now when we're coming onto the ball, we're not right next to the spine because we have the erector spine coming down on either side. We're going to come a little bit out. So we're coming in on an angle between the bottom of the rib and the top of the pelvis to try and compress and mobilize that tissue. So position the ball just in that wedge between rib and pelvis on the outside of the muscles of the spine, and we're going to come down onto the ball. Now we can use our body weight to move forward and back to catch different parts of the tissue. Also useful is straightening and bending the hip. So anywhere that you find is a little bit more tender than the rest, you might stop on that spot, take 2 or 3 deep breaths, trying to actively relax and release through the muscle and let the trigger point ball sink into the tissue. Okay, we can bend and straighten the hip. We can also use the arm to create a little bit of length through the tissue and allowing the ball to sink in, moving left and right, up and down to try and just work through the tissue. So we're moving from the rib down to the top of the pelvis, stopping anywhere that feels like it needs some attention. We can add in the arm and the leg for a little bit of added tissue work. Typically 1 to 2 minutes is going to be plenty. Remember, we've got one on each side. One side might be different to the other, so just go as you feel feels best.